Good morning. Hi, I'm Linda Resar. I'm a pediatric hematologist oncologist at the Johns Hopkins University School of Medicine. I am an MPN doctor, and I'm also passionate about MPN research and finding ways to prevent disease progression. I know all of you have heard a lot from Johns Hopkins University over the past several months, in part because our institution is keeping track in real time of all of the COVID-19 cases. And I know for those of you with MPN, you've got many questions about COVID. You want to stay healthy, and I want to help you with that. So today I've entitled our discussion MPN in the time of COVID-19. And I'm sure many of you are familiar with the wonderful novel by Gabriel Garcia Marquez, Love in the Time of Cholera. As I mentioned, I really love to take care of MPN patients, and I'm excited about our research, so I thought that this would be a great title. So what I will be sharing with you today is the Hopkins experience, and I already alluded to the COVID-19 map. As I mentioned, I'm an MPN doctor. I'm trained as a pediatric hematologist oncologist, and which, as you may know, is quite rare, but we do have patients with MPN. Because it's rare, I really have patients all over the country, not only in the Baltimore area, which is where our institution is located, but also Virginia. I have a college student in Rochester, Minnesota, and I even get consulted on patients as far as California. I also have a patient who's a recent refugee from Syria. So really the scope of patients that I'm caring for is the entire globe. As I also mentioned, I'm an MPN researcher, and we have many models in our laboratory, including cell-based models, patient samples. We even have mice with MPN, and we continued some of this work throughout the pandemic as well. I know many of you are on medications for MPN, and you're probably wondering, well, what do these medications mean in terms of COVID-19? Will they make me at higher risk for infection? Will they protect me? So we're going to touch on that as well. And then finally, actually, my mother, who lives in Wisconsin, was just diagnosed with MPN. So this is a subject that's very dear to my heart. I know those of us who care for MPN patients want the very best for our patients. So let's go on to the Hopkins experience and the COVID-19 map. So you probably have heard about this on the news, and this is just a screenshot from my cell phone. You can access the COVID-19 map on your cell phone, on your laptops, on your iPads, and you can see, you may be able to see from the top, if you Google coronavirus.jhu.edu, this will come up. And this particular screenshot is a couple of days old, so these numbers are a little bit old, but you can see that Hopkins is tracking all of the cases throughout the world, something that I think will be more valuable to my patients who are scattered predominantly across the United States is the statewide map. And this will tell you the number of cases per state, and it will also tell you how the cases are going up. And I think this is very important as you plan activities to know what the status is of the infections in your area and whether they're increasing or decreasing. You can also look at the counties, and there are maps where this is, I know, quite a small map, so it's a bit hard to see the detail. But if you go to on your own phone or your own computer, you can zoom in, and the darker colors shows where there are more cases, and they show you by county. So these resources are quite valuable, particularly for physicians like myself who have patients all over the country. So when my patients ask me what kinds of precautions they should take, what they should be doing, this map lets me know the status of the infections in their area in real time. So what are we doing at Hopkins? The next slide shows some of the screening questions that we're asking patients who call in and say, I think I may have COVID-19. What kind of symptoms should I be having if this is true? So we typically ask if they have two of the following, and I'm sure many of your clinics and doctors have a similar questionnaire. We found this one to be very helpful. So we ask patients if they've had a new fever, cough, sore throat, shortness of breath, muscle aches, diarrhea, or headache. And actually, when this questionnaire was first developed 3 months ago, we didn't realize that a number of patients have diarrhea. And it was only over time that we learned this is another symptom. We also ask patients if they've had an unexplained loss of taste or smell. It was learned as the pandemic progressed that this was a pretty common symptom. And then whether we test a patient or ask them to self isolate depends on exposures and where they will be going. For instance, healthcare providers on the front line, if they have a couple of symptoms, we definitely screen them because we don't want any healthcare providers to be exposing patients to the infection. So that's just a sampling of the questions that we use at Hopkins. The next slide shows our cases over the past couple of months. And the Hopkins healthcare institutions include 4 hospitals. I'm at the largest hospital downtown, Johns Hopkins Hospital. That's shown in dark blue. I think we jumped ahead. We have a few other smaller hospitals that are out in the community, and Hopkins has the most rooms that are suited for patients with COVID, so we tend to have the most patients. That next slide, let me just back up once. This shows how many patients are on ventilators, and it's really not the majority, fortunately. It's less than half of the patients who are getting admitted who are requiring a ventilator. And I just want to show briefly, this is the number of patients who have passed away with COVID. It's really the minority of patients. Most of our patients are getting better and going home, and most of our patients are not requiring ventilator support. So that's good news. As I mentioned, my patients are all over the country. So what does this mean? When I go to the Hopkins map, I look at their state. So here I just took a little piece of it. This is New York and New Jersey, which I'm sure all of you know has been the epicenter of the infection in this country. They have the most cases, New York, New Jersey, Connecticut. And then the states, for example, Texas and Florida are more similar to Maryland. They have fewer cases. So this map, again, is important because it tells us by state and also even by county. So now I'd like to turn to what you all can do to take care of yourselves during the time of COVID-19. And I call this MPN self-care. So first, I really want to stress that I want all of you to wear masks when you're going out in public. Now, it's surprising to me, but there are states where this is the law. In Maryland, for instance, when we're out in public, we have to wear a mask. And that's based on evidence. It's a good way to prevent a sick person from spreading respiratory droplets to a person who's not sick. And so for this reason, it's a very good public health measure. Where my mom lives, for instance, in Milwaukee, in Wisconsin, it's not the law to wear masks in public, but I sent her some in the mail and I encourage her to do that, and she is. So even if your state laws do not mandate it, I strongly recommend it when you're in public. And many people ask us, well, do I need an N95 mask? Those are the kinds of masks that our nurses and healthcare providers in the ICU are wearing when they're exposed to patients with COVID-19. They will block almost all respiratory droplets and virus, and that's really not necessary for us going to the grocery store or out in public. So just a mask, any kind of covering is really helpful in preventing spread of respiratory droplets. And that's how this infection is spread. The other thing, and I know you've heard this a lot, wash your hands. And actually the recommendation is 20 seconds, which is quite a bit longer than you might think. As soon as I learned this recommendation, I started counting. And you might try that and you'll see it's a bit longer than you might imagine. But really scrub your nails in between your hands. This is another easy and very effective public health measure to prevent infection. The other thing that's being recommended, stay at home. I'm sure you've all heard hashtag stay home. And this is really important. On the same hand, it's very hard, and especially for our older patients who may live alone, it's isolating and very lonely. So I really want to encourage you all to stay connected as much as possible, even while you're quarantined at home. And you can do that with your cell phone and FaceTime. You can do that with iPads or laptops if you have those. And I know many of you may not actually have used FaceTime as much. I know my mom used to prefer the telephone, but since she's been isolated, she's really found it helpful and comforting to be able to see the faces of her children, of her grandchildren. And so I want to strongly encourage you to stay connected as much as you possibly can. It's difficult, but I think our cell phones and other devices help to keep us connected. It's not quite like getting a hug, but it's really helpful. And then of course, social distance. And even when I'm waiting in line at the hospital where we have marks on the floor and everybody should be pretty well aware of social distancing guidelines, people forget. They kind of bump up in line. And so just be very cognizant, especially if you have MPN. My goal is to keep you as healthy as possible. So keep in mind the need to social distance. We say 6 feet. So I'm not very tall. I'm about 5 feet 2 inches. I spread out my arms and I add a few inches on each side, and I figure that's about 6 feet. So try to estimate 6 feet and try to stay away from people by about 6 feet. And the other thing is we all are getting inundated with news. It's very often stressful and not happy news. So while I want you to be aware of guidelines from healthcare professionals and public health officials, and I want you to be aware of what's going on where you live, I also recommend stay away from the news for a portion of the day. Don't look at the news or the maps before you go to bed. At least I found that to be helpful. You want to know what's going on and you want to be taking the guidelines of healthcare officials, but it's really important to take a break from the news. And again, as I mentioned, please follow the guidelines of public health officials. There are states where people don't have to wear masks. I think there are states in parts of the country where social distancing is not mandated. Healthcare professionals know that these measures are helpful, so please follow them. Okay, so now let's talk a little bit about COVID-19 and MPN. Some of you have probably heard that MPN medications are even being tested in COVID-19. And so I want to show you what's going on inside the cell with this slide so you can understand that with a COVID-19 infection and with MPN, there are some common pathways. In both settings, there's a lot of inflammation. And that's why some of the MPN medications are actually being tested with COVID-19 infection. And actually, another webinar by Dr. Ritchie goes into great detail about ruxolitinib and COVID-19 infection. So if you want more details on ruxolitinib, please watch her video. It's excellent. So the COVID-19 virus, which is coronavirus, the new one that's been around in this country since about the first of the year. Scientifically, it's called SARS-CoV-2 for severe adult respiratory syndrome coronavirus 2. And you've all have seen this, I'm sure, in the news, the coronavirus picture itself. It's called corona. Corona means crown, and you can see around the virus there are projections which look a little bit like a crown. So what happens when our cells get infected with this virus? And we know our respiratory tract can get infected, our nose, our throats, our lungs, and our GI tract. So for this virus to infect our cells, it must bind to a receptor. So it's sort of like putting a cup on a saucer. The saucer is the receptor. It's called ACE2. And there's actually quite a bit of research going on regarding ACE2 currently, because we know some patients become very ill and get a life-threatening pneumonia with COVID-19 infection. Some patients have no symptoms. And there is some research going on to determine whether it's levels of ACE2 or its variance in ACE2 expression or other variations that may in part account for this difference. Once the virus binds to this receptor, it releases its genetic material, in this case it's RNA, and that release requires enzymes. So there may be differences in patients in the levels or the functioning of their enzymes to also account for differences in symptoms. Once the genetic material is released, it stimulates a number of factors within the cell. For instance, there is a release of inhibitory factors, and this allows another factor called NF-kappa B. It's an inflammation driving factor. This goes into the nucleus of our cells, and it activates inflammatory pathways, which I've shown here with the big red arrow. And I threw in some fire too to make the point that this is an inflammatory pathway. And this includes cells, specific cells that are highly inflammatory, and specific factors. Now, what does this have to do with MPN? So many of you have heard about JAK-STAT signaling. That's also a pathway in our cells which activates inflammation. So JAK is a receptor, sort of like the ACE2 receptor, but in this case, it binds to growth factors that are made in our bodies to make blood cells. These factors bind to the JAK2 receptor. It changes the conformation. So there are two partners, they come together, and then they activate a protein called STAT, which I've shown here in the blue dot. STAT becomes activated by a phosphorylation event, which I'm showing with a little yellow dot. Once it becomes phosphorylated, it teams up with another STAT, so it forms a dimer. These are a team of two STAT proteins. And then it goes into the nucleus and binds to our DNA, and similar to coronavirus, it turns on inflammatory pathways. So many or some of you are on JAK-STAT inhibitors, and you can see that's acting up at the top of the cell to block these inflammatory pathways. And ruxolitinib, for instance, inhibits JAK, and that is being tested in coronavirus patients for the reason that I just mentioned. It blocks inflammation. And in my laboratory, we're studying a factor called HMGA. I've shown in pink here. This is another important factor for driving inflammation, and it teams up in many cases with NF-kappa B. And similar to coronavirus, similar to STAT, it turns on inflammatory pathways. So we're actively researching how to block these pathways in MPN, and some of these approaches and strategies may in fact be helpful in coronavirus infections as well. So MPN in the time of COVID-19, what about the medications and treatments that you're on? Do they pose any risks? Do they pose any protections? What do you need to think about? So as I mentioned, many of my patients are young patients who have very few symptoms from their MPN. And that may be true for many of you listening. Some of you may just be on a baby aspirin. And baby aspirins, you know, are partially anti-inflammatory. They're safe medications for most of us. Sometimes with MPN, we can have abnormal bleeding when the platelet count gets too high. So if you're on a baby aspirin and you're doing well and not having bleeding symptoms, you can stay on that. Talk to your hematologist if you have questions, but we don't feel that baby aspirin poses any increased risk for coronavirus. We don't feel that it protects you in any way from coronavirus. If you're on it and doing well, please stay on it. If you're on it and have abnormal bleeding, please talk to your hematologist. Now, Rux, as I mentioned briefly in the preceding slide, it blocks the JAK-STAT signaling and some inflammatory pathways. If you're on it and doing well, please stay on it. Whether it will really help you if you get coronavirus is not yet known, but there are studies going on in New York as we speak. I think over the next several months, we will find out if Rux is helpful not only to our MPN patients, but also to patients without MPN. There are other drugs similar to Rux that are also being treated. So this is something we'll know over time. But if you're on it and doing well, please stay on it. We don't think it makes you at more risk for a coronavirus infection, and we don't think it protects you. It may have a role in some of the inflammation, and we won't know that until we've studied it further. What about Pegasus, that interferon? I have patients on Pegasus as well who are doing beautifully, and they have continued on this throughout the pandemic. So if you are on Pegasus interferon treatment, please continue it. And as with the other agents, we don't know if this should increase your risk or decrease your risk from a coronavirus infection. Pegasus can actually elicit in your cells a viral-like infection scenario. So it's possible that it could trick the cells into thinking they have a virus infection and mount an antiviral response. It's possible that it does not have any impact on a virus like COVID-19. So if you're on it, you're doing well. We don't think this puts you at more risk or less risk. So talk to your doctor, continue to get your blood counts checked so that your doctor can monitor your progress on Pegasus. My young patients who are currently on this are doing well. My patients on Rux are doing well, and my patients just on baby aspirin have continued to do well throughout the pandemic. I just want to say a couple words about BMT. This is a treatment that's used for some patients who progress to fibrosis. It can require a great deal of immunosuppression, especially in the period around the time of the transplant and for several months or even years after the transplant. So, if you've had a bone marrow transplant and you're immunosuppressed, I want you to be particularly careful. That's a period of time when you're at increased risk for a whole host of different types of infection. So, if you've had BMT, we believe you may have an increased risk for complications from any kind of infection. So be particularly careful and please stay in close touch with your hematologist and oncologist. So now I'm going to go on to tell you a little bit about my research. I want you all to know that during this pandemic, we've stayed busy taking care of our patients and trying to continue research as much as possible. You know, of course, many personnel are working at home and we're not at the same level, but we're still continuing to work hard on looking for cures and treatments for MPN. So let me just share with you a little bit of our work. I mentioned to you that I'm studying a gene and a protein family. They're called HMGA, and they work in our cells to turn on inflammation pathways. They also turn on leukemia pathways. And we got interested in this years ago because we found that when we look at samples, normal bone marrow samples, which include stem cells and progenitors, those are shown under, they're called control in my slides. And we compare those to patients with PV, so just predominantly an elevation in red cells, a pretty mild course, generally mild disease. We find that the levels of our gene and protein go up. And as your MPN progresses to myelofibrosis, which is generally a worse disease and it's associated with worse outcomes, the levels go up even higher. And if a patient progresses to leukemia, I'm showing that in the circles, the levels go up even higher. And those other the two dots showing the highest levels had leukemia with lots of mutations. So this gave us reason to suspect that these genes and proteins were important in driving progression. And so we started to study, well, if these factors are required for MPN to progress, we wanted to learn more about how they're working so that we can block them and prevent progression. And so we have all kinds of models. I'm just going to share with you a couple of, I think, really exciting recent discoveries. These are actually spleens from our mice with MPN. So, yep, we have, in fact, mice that get MPN. It's very much like what our patients get. So it's a very good model for us to test new drugs and to figure out what's happening. And this is a picture of the spleen. It actually, honestly, looks quite a bit like human spleens, of course, smaller. They're from mice. The one on the left that's labeled WT, that's for wild type. That's a wild type normal mouse, does not have MPN. The next one over that's labeled JAK2 V617F, that's a mouse with MPN, and you can see it's a much bigger spleen. It's full of the tumor cells. If you look at the one next to it, the smaller one, that's a mouse with MPN that we crossed to another mouse that only has a half a dose of the HMGA gene, and it's virtually normal. So we found in this model that if you cut down the amount of this gene and protein, HMGA, you can normalize the spleen size. The mice do not develop big spleens and they do not develop myelofibrosis. If you get rid of 2 doses of the gene, that's shown on the right, that's labeled KO for knockout. Similarly, the spleen size is normal. And here's just graphs looking at the spleen sizes. The dark blue one is a normal mouse. The turquoise one is a mouse with MPN. And you can see the yellow and pink, they're back down to normal. And that's just looking at them before we've taken the tissue and looked under the microscope. These are bone marrow, and many of you with MPN have gotten a bone marrow aspirate and biopsy. Sometimes it can help us figure out what's going on and how progressed your disease is. The one on the left is actually from a normal mouse, and it looks almost identical to a normal human marrow. The one in the middle is MPN, and you can see this is a mouse whose disease has progressed. The mouse has fibrosis and scarring, shown in the dark pink there, and has too many cells in the marrow, which is characteristic of our patients with MPN. And then on the right is the same mouse with MPN crossed to a mouse with only half the dose of HMGA. And again, it looks very normal. So we're really excited about that. Here's some special staining. And again, these look identical to human marrows. This is a stain for megakaryocytes. Those are the progenitor cells that make our platelets. And I know many of you have platelets that are higher than normal. So on the left is the wild type mouse, the normal mouse. In the middle is the MPN mouse. You can see too many platelet progenitors. And on the right is a mouse who just got half the dose of HMGA, and it converted the marrow to a normal marrow. So we also have a mouse that even gets leukemia, and I'm just going to show you a picture there. The blood cells on the right here are leukemic cells, and just like in humans, the levels of these mouse genes for HMGA1 and A2 go up. And I'm going to show you what happens if you take this mouse with leukemia and you cross it to a mouse with half the dose of HMGA. So these mice, it's a very, very aggressive leukemia. They die at about 5 to 8 weeks of age. If we cross it with a mouse that gives it just half the dose of HMGA, they live twice as long. So this is evidence to us that if we could find a way to decrease the level of this gene in our patients, we may prevent them from developing progressive disease and help them lead longer and healthier lives. So we're working hard on trying to figure out how it's working. We use gene expression data where we do very high powered next generation sequencing where we can find out what genes are turned on and what genes are turned off. As you might imagine, this factor is turning on cell growth, and it's also affecting inflammation. And then what we do is we can feed these pathways into specialized software, and we can figure out, well, what drugs can block these pathways? And so we've identified some drugs, and we're screening them with MPN cells from patients. And we're finding that some of these drugs we identified from our models are very effective in slowing the growth of MPN cells. So I just wanted to share that with you to let you know that we're working hard on finding cures and finding treatments that will help you stay healthy for a long, long time. So now let's turn to visits with your doctor, treatments and visits. We talked about the medications. Now I want to talk about the actual clinic visits. So as you heard from some of the other webinars, we're here for you. We still have open clinics. All hematology and oncology centers can see patients when it's necessary. And sometimes it is necessary. So please don't hesitate to reach out to your provider if you need to be seen, they are there for you. However, we're finding that many of our patients can be seen with what we call a televisit. We can chat by phone, or we can even use a video. Sometimes we use FaceTime. Sometimes we use a specialized program that interdigitates with the electronic record for our patients. And I've used, actually more often than not, FaceTime works better for my patients, and we use that more than our specialized telemedicine videos. But most clinics throughout the country currently are using televisits and video visits to a large extent, because we want to protect you from having to go to a clinic and get exposed to somebody who could have COVID-19. Now, all clinics and hospitals undergo very extensive screening to prevent patients who could have COVID-19 from going to clinics. So if you do need to go to a clinic, it's safe and your provider will be there for you. If you can avoid it though, that's always better. And I'm finding, I just had a video clinic yesterday. They really work well. And it's nice to be able to see our patients in their home settings. I think some of them feel a little bit more comfortable just telling me how they're doing. And as I mentioned, many of my patients are young, so I've got lots of teenagers and young adults, and they're, as you probably know, fabulous with FaceTime and iPhone. So for many of them, I think they find it a more comfortable experience. So that's working quite well. And when our patients do come to see us, whether it's by telephone, by video visit, or in the clinic, what do we tell them? And you've heard all this before too. If you are smoking, try to enter a cessation program. I'm sure that there are programs online that you could enroll in. Smoking causes inflammation, and you know that with MPN, there is increased inflammation. With COVID-19, there's increased inflammation, and all those things are bad in terms of health. and bad in terms of outcome for COVID-19. If you have high blood pressure, continue to take your medicines, stay in touch with your doctor, check your blood pressure. That's another situation where we know it's associated with underlying inflammation, and that can make MPN worse. It can also, of course, be associated with worse outcomes with COVID-19 infection. If you have diabetes, again, continue your medications and do your best to control your blood sugar. Stay in touch with your doctors. This is another chronic illness that's associated with inflammation. If you're overweight, try your best to control your weight. Exercise, I know that can be really challenging now. Some of my patients, actually, one of my patients told me yesterday she does an online exercise program with her cat. And I said, wow, that's fabulous. So there are quite a few YouTube videos where you can find exercise. If you can go outside and walk with a mask, that's also can be just excellent exercise and can help you feel better. The only thing I want to caution you with going to YouTube, make sure you pick an exercise routine that's in keeping with your level of conditioning. You don't want to do something that you're going to hurt yourself with. And as I mentioned before, FaceTime your doctors, FaceTime your family, FaceTime your friends and loved ones. It's a good way to stay in touch and to stay close. And again, as we just talked about, if you need to see your doctor and you don't feel there's anything urgent or any real reason to go into a clinic, find out whether they can video visit or televisit. Most of us would like to do that whenever it's safe. So talk to your doctors and healthcare providers. So now I guess we can go to our summary. I hope I've convinced you that I'm really passionate about MPN. I want to take the best care I can of my patients. I want to find new treatments in the laboratory. So MPN and love in the time of COVID-19 is what's happening here. Wear masks, as I mentioned, social distance. Even if your state says you don't have to, please do this. Stay connected to your family, friends, and loved ones. This is really important. Stay connected to your doctors and healthcare providers. If they don't have a means to do telemedicine and you don't need to go in, talk on the phone, even email if that's feasible. I think most of us are trying to really expand the modalities that we have to communicate with our patients because we want you to be safe. And exercise, self-care. So we talked about exercise. I'm a big fan of yoga. Many MPN patients really find that beneficial. Again, we can't really go to studios anymore, but there's lots and lots of yoga on YouTube. Just pick a level that works for you. Get sufficient sleep. We know that insufficient sleep can suppress the immune system. So extra sleep or enough sleep is helpful in staying healthy, and try to eat a healthy diet. And again, stay tuned, and in particular, to the advice from public health officials. Sometimes, again, the laws are not consistent with our public health officials' advice, and I would like to direct you to that. You can look at websites, for instance, the CDC. You can look at the Hopkins Coronavirus Map and find the data that way. So lastly, I just want to say thank you to all of you. I want to particularly thank my patients and their family members who are doing all they can to stay healthy and stay connected. Many of you know the MPN Advocacy and Education International Agency. That's why I'm here today. In particular, I want to thank Anne Brazeau and her wonderful team. She does an amazing job of connecting the physicians, the scientists, and the patients, and I find that to be extremely valuable and inspirational. And thank you all for listening. I also want to thank my team. We don't do any of this work alone. These are members of my lab. This was our summer crew. We get lots of summer students. This was our crew around December, and this is our most recent crew. And we're all continuing to work hard so that our MPN patients can live long and healthy lives. And these are our funding agencies. So thank you very much.